So, dengue fever is a viral infection. It causes high grade fever, body pain, headache, rash, and in severe cases, it can cause bleeding, which can be life threatening. So, along with fever, bleeding is a complication that can occur, and that makes it different from the other common viral infections which one gets. So, dengue is a mosquito-borne disease caused by flavivirus. It occurs by the bite of a mosquito known as Aedes aegypti, and which bites multiple people. So there is a increased risk of widespread infection. So it's a mosquito-borne disease. So India is a tropical country, so the weather conditions are favorable for mosquito breeding. Another thing is in urban areas there is high population density, which increases the spread of infection. Along with that, we have increased travel amongst people, so people are traveling from one place to another, so the transmission also increases. Higher temperatures, so and rainfall also we have being a tropical country which favors mosquito breeding. So those are the issues, those are the causes by which we have more dengue cases in our country. So the common symptoms of dengue fever are: one is high grade fever, another is retroorbital pain, that is pain behind the eyes. Then you have headache, joint pain, bone pain or muscle pain. You can have nausea and vomiting and development of rash over the body. So and in severe cases you can have bleeding from the mucosal surface or internal organ bleeding. Dengue fever becomes life threatening when there is internal organ bleeding, as I said, so which is known as dengue hemorrhagic shock. Also, when there is excess of fluid accumulation in the lungs, it can lead to pulmonary edema, that is, it can cause respiratory failure. Commonly, dengue hemorrhagic shock is is a complication which can be life threatening. Dengue common tests which are done is: one is the NS1 antigen, that is the dengue viral antigen is detected in the blood. Another way of checking is by doing blood tests for the IgM and IgG antibody titers to the dengue virus antigen. A third way of checking is via the RT-PCR test, that is, it detects the dengue virus genomics in the blood. So depending on the day of fever which the patient has come and depending on the history, these tests can be done to diagnose dengue fever. So the do's are: the first is the it's a viral infection. So one is patient has to take rest, take adequate fluids, eat healthy diet, eat nutritious food, and cover themselves, wear protective clothing so that the risk of transmission to others around, to the family members, can be stopped. Don'ts are: one is to avoid taking strong painkillers, and also they should eat well, take prompt treatment. If they have bleeding from the gums or the nose or the mucosal surface in the mouth, they should consult the doctor immediately. Or if there is blood in urine or stools, they should not wait, consult a doctor and take timely treatment. Dengue fever in mild cases, it's a supportive treatment, fluid replacement by giving IV saline, IV fluid replacement, giving acetaminophen or antipyretics for fever and for pain, and giving tepid sponge baths in case the fever is high grade fever, not responding just to medication. Also, in patients having bleeding complications, timely treatment, management of the bleeding complications, giving platelet transfusion when necessary, and ICU monitoring in severe cases so that whatever complications arise can be treated and that timely treatment can be given. Post dengue symptoms occur in some patients. So they can have joint pains, they can have hair loss, they can have decreased appetite, tiredness, And so these some symptoms can persist for a longer duration, and they may require more time, more rest, or they may have loss of working days because of these prolonged symptoms. Okay, so prevention of dengue fever is since it's a mosquito-borne disease, we have to prevent mosquito transmission and transmission from person to person. So, every person should wear protective clothing, which covers the whole body. Use of mosquito repellents, mosquito nets, and having window shields. So, in the house, so that the mosquito bites and the transmission is reduced. Also, certain measures which have to be taken at the community level, that is containing the mosquito breeding by using appropriate pesticides for the mosquitoes.